And we're doing the hip hinge today. So if you come and lie on your backs, you're going to need a broomstick or a mop handle or a TheraBand, one of the TheraBands that is a loop, not just with two separate parts, unless you can tie it together at the end. So come and lie on your backs. Alright, so start hip distance apart with the feet. So I can see, yeah, you can see me. So hip distance apart with the feet. And we're just going to think about the connection first. So where can we feel connection between our bodies and the floor? So we should be feeling it underneath both feet, underneath the lumbosacral junction, underneath the TL junction, both shoulder blades and the back of the head. So we're going to work on our posture now, try and get better connected with the floor. So we're going to think about the feet first. So where are you feeling the weight more? Are you feeling it more on the left foot or more on the right foot? And we're just going to shift the weight from side to side. So we want to be a bit more balanced. So you want to feel it equally from right foot to left foot. And then where are you feeling the connection on the foot, each individual foot? So are you feeling it on the outside or are you feeling it on the inside? If you're feeling it on the outside, try and bring the inside down towards the floor. If you're feeling it on the inside, try and bring the outside down to the floor, but without lifting the opposite side off the floor. Okay, so once you've got a little bit better connection between your feet and the floor, we're going to work our way to the lumbosacral junction. And what we're going to do, we're going to tilt the pelvis anteriorly. And by doing that, you're going to lift the spine away from the floor. And then we're going to tilt in the opposite direction into a posterior tilt. And the spine's just going to cave into the floor. And then pull away and back. So going between anterior and posterior tilt. And then we just want to stop in the midpoint between the two end ranges. Your lower back should be flat on the floor. It shouldn't be caved into the floor, but it doesn't want to have any gap between your back and the floor. And we're going to try and keep that neutral pelvis, neutral spine throughout the flow. Then we're going to work our way to our TL junction. So rib cage and pelvis want to be parallel with each other. So we're going to think of them like the pages of a book. So we don't want the pages to be open, so we'll get that lumbar extension and rib flaring. So we're going to pull the pages together. So we're closing the book and getting the pages of the diaphragm and the pelvic floor parallel with each other. And you should feel more connected between your TL junction and the floor now. And then we're going to work our way to the back of the head. So eyes want to be straight up towards the ceiling. You're going to push your head back towards the floor. You don't want the neck to go into any extension or any neck flexion. So going straight back down. Feel the front of the neck muscles come alive. And I've just realised we've missed the shoulder blades. So the shoulder blades want to be equal from side to side. So you're going to shift the weight, try and get a little bit more balanced, same as the feet. And the shoulders, they want to be in a neutral position, so we don't want to be in elevation, protraction, internal rotation. So we're going to try and externally rotate, depress, and slightly retract the shoulder blades. So they're in a neutral position. And we're going to work on our breath now. Now we've got better connection. So one hand on the chest, one hand on the tummy. And we're just going to think about the breath and think about which hand's lifting as we breathe in and which hand's lowering as we breathe out. So as we're breathing, the hand on the chest doesn't want to move anywhere. The hand on the tummy wants to lift on the breath in and lower on the breath out. Breathe in through your nose, out through your mouth, through pursed lips, like you're blowing through a straw. Try and focus on the breath, focus on what's happening underneath the hands, making sure that the hand on the chest doesn't move anywhere. Just do a couple more breaths. So once we've got the breath in the right order, what we want to do is try and create our 360-degree breath. So you're going to put your hands around your waist, fingertips into the bony bits, web the hand around the waist and the thumbs into the back. And as we take a breath in, you want to feel all the muscles under the hands, the front, back and sides. Lift and try and push your hands away. So you want to feel it equal from front to back and symmetric from side to side. So if there's any areas that you're struggling with, if you really try and focus on that part, you're also going to cough. So give a little cough just to wake the muscles up, let your brain know where they are. Feel the expansion. Give the muscles a bit of a prod, wake them up a little bit more. Okay, once you've got the 360-degree breath, just going to think about the brace. So we need the brace when we're doing something that needs more stabilisation. So 360-degree breath day to day, and then when you're doing something that needs a bit more stabilisation, you want to create your brace or your outward push. You don't want to clench, tense or suck the belly button in. It's an outward push. So breathe in, expand. And then before you take the breath out, you're going to pretend that you're farting or imagine that feeling like when you're about to fart. And try not to let the abdominal wall muscles completely relax as you're breathing out. Do a couple more breaths. Okay, so we're going to start the flow, and we're going to start with single leg lifts. So we're going to hinge the hip into flexion and then lower it down. Hinge the other leg and down. So we're flexing, extending the hip on one side, flexing, extending the hip on the other side. When you're flexing the hip, take the hip into slight external rotation at the same time. And then as you're extending, into slight internal rotation. This movement just wants to come from the hip doesn't want to come from the body or the pelvis, spine. So we're keeping that lumbar spine flat on the floor, pelvis is staying neutral. Just do a couple more. And then we're going to go into a double leg lift. So you're going to need to create your 360-degree breath, your outward brace, and you're going to lift the legs up into the air. So you're flexing both hips, so hinging at both hips, and making sure that that pelvis doesn't tilt forwards as you lift your legs into the air. So we're creating our 360-degree breath, then our brace, and lifting, hinging the hips, and down. So extending and flexing. Try and make this movement just come from the hip. Lower back stays flat on the floor, pelvis in that neutral position. So flexing and extending, doing some toe taps. And then we're just going to finish up in the air in the 3-month supine position. And what we're going to do now is we're just going to extend one hip away and extend the knee as well. Keeping the lower back flat on the floor, neutral spine, and then the opposite side. No movement in the lower back or pelvis. If you can't fully extend the hips, that's fine. And the knees, you're just gonna toe tap. So don't want you to put any strain on your lower back. So if everything's tensing and your lower back's going into extension, or you've got any lower back pain, you're just gonna do some toe taps. If you can, if you're finding that quite easy and you want to try and do double leg hip extensions, again, trying not to let the pelvis tilt forwards and lower back extend. If you can't do double hip extension, knee extension, do double toe tap again. Again, as you bring in the hips up into flexion, you're externally rotating the hip at the same time. And as you're extending, you're internally rotating. Just do one more. So definitely, if you've got any lower back issues at the moment, I wouldn't advise you doing the full hip extensions. And then we're going to take the arms up, just bring the knees up into the chest, just give the hip flexors a little bit of a rest. Arms up into the air, fingertips to the sky. Lift the head slightly, look to the direction that you're going to be rolling. And we're just going to roll, pelvis and shoulders come in at the same time. Try not to let the pelvis and shoulders disconnect. And then onto the back, tap the toes, so double toe tap, roll onto the other side, back, double toe tap, hinging the hips, not the lower back and pelvis, Roll the other side. And back. Just trying to help improve that rotational stability at the moment. So each time you come back onto your back, you're going to do your double toe tap with the hip hinge. Nice and controlled on the way down and the way back. Try not to let the spine banana, so we want a nice straight spine. And then we're just going to roll up onto our lower oblique sit. And from this position, we're going to lift the hip. Try to have a nice straight spine again. And we're just going to do some hip flexion, extension. Flexion, extension. So hinging the hip, try not to round the back as you bring in this leg in. You should feel it in the opposite glute, the one that's supporting. And then lower down. Make sure that the shoulder's nice and active, so you're not just collapsing on the shoulder, so you're pushing through the floor. Then you're going to come up into your high oblique sit. And again, we're going to lift up and we're going to flex the hip. And out and extend. Flex, extend, flex, extend. Try not to let your spine collapse. Your bum should really be feeling this on the opposite side. Do one more. And then down. We're going to take the foot forwards. And then, oh no, sorry, we're doing a lift. So we're hinging. Forgot what I was doing then. So we're in the high oblique sit, or the tall oblique sit should I say, and we're going to hinge forwards. So we're hinging at the hip. Try not to just round as you come forward, so we're just going to hinge forwards and backwards. Just trying to create that movement. And then once we've gone forwards, we're going to lift. Try and keep that neutral spine as you lift. And hinge backwards. If you need to, grab hold of a book or a yoga block and put it underneath your hip, underneath your bum, so that you've not got as far to travel. Go really nice and slowly so you're not landing too heavily on your knees. So you just need to get something to put underneath there to wedge you up to come, so you've not got as far. Okay, so we're hinging up, trying to keep neutral, and down. Do one more. You can put your hand on your tummy and your back as well to feel what your pelvis and your lower back's doing. So now we're going to put that foot in front. You're going to lift your bum, twist round, come round to the other side, down into the lower oblique sit. And then we're going to lift, and we're going to do hip flexion, extension. Just from the hip, not from the lower back or pelvis. And then lower down, up into high oblique sit. You're going to lift and flex, extend. Let's do a couple more. Lower down, then we're going to do our lifts. So we're just going to hinge forwards first, so forwards and backwards. Put your hand on your tummy and on your back, and just feel that movement, that angle doesn't really change, it's just coming from the hip, this movement. And then try and lift and lower. Again, if you need the block underneath your bum, and then hand on the back and pelvis. Last one. Bring that leg forwards into your tripod. Okay? And then what we're going to do is we're going to hinge, we're going to hip hinge. So with the tripod, we want to try and be nice and flat, so you're not rounded through here. So if you need to again get a block to put, or some books to put underneath your hands. And then we're just going to hinge backwards. So what we don't want to do is, as we're going backwards, round like that. So just go as far as you can without starting to round, and then just hold it there. Breathe 360 degrees, try and lengthen through the spine, and then on the exhalation, if you can get a little bit further back, great. So we're hinging backwards and forwards. Nice and long through the spine. Try and feel that movement in the hip. Obviously with this, only go as far as that back knee is going to allow as well. So if your knee's a bit sore, don't go as far back. And then from this position, we're going to go from a tripod up into a high kneel, into a tripod, high kneel. What we don't want to do is, as we're going down, just round into the back. So we're trying to keep flat through the back, and we're trying to make this movement, again, come from the hip. So up and down, from tripod to high kneel to tripod. And then we're going to end up in high kneel. So high kneel, we want, again, neutral spine, so find your neutral. Make sure you're not too narrow. Take the foot to the side slightly. Pelvis level with the floor, so we're going to pull it down so it's parallel, so we're not all slanty and wonky. So find that neutral, and again we're going to hinge backwards through the hip. Again, only as far as that back knee is going to allow. Coming back up. Try not to let the pelvis come forwards as you're coming up. So we're going to try and keep neutral. Just do one more. Okay, so now we're going to go from a high kneel into our stand. So we're going to curl the back foot under, shift the weight forwards and come up. Trying not to let the knee collapse, so as we come up we don't want to shoot out to the side. So if you need to, get hold of a chair or a bedside table. Put it to the side that you can just rest your hand on and give you a little bit of support coming up and back down. As you're going up and down, keep the pelvis level with the floor. Steady yourself, lower down, completely level with the floor. Nice and slowly down. Don't rush this movement. And then we're going to swap sides. So we're going to take the right leg back and lower down. Into tripod. Again, we're going to try and get nice and flat through the upper back. So if you need to get on a block so you can get that nice long spine, that's fine. So we're lengthening through the spine and we're just hinging backwards. As far as you can go, as far as that back knee is going to allow. You'll probably find that there's a difference between the sides, like one side will be easier than the other. This is my difficult side, so I have to really concentrate on trying not to let my lumbar spine flex. So breathe into it, feel that expansion, and then just try and go back a little bit further on the exhalation. Nice flat spine, nice long spine. Last one. And then we're going to go from tripod into high kneel. Into tripod. High kneel. Tripod. So keep going from tripod to high kneel. And then last one, into high kneel. Again, pelvis level with the floor. Neutral lower back. And we're gonna hinge backwards. Again, only as far as that back knee will allow. Trying to keep this neutral spine. Put your hands around your waist if you need to. Feel what's going on there. So hinging at the hip. Trying not to flex the lumbar spine as you go backwards or extend when you come forwards. Do one more, and then we're going to stand. So you need to get your chair, so take that foot forward, so not too narrow, bring it to the side, pelvis level, neutral spine, curl the back foot under, shift the weight forwards and stand. Trying to keep the pelvis level, try not to shoot to the side, knee collapse. So we want to keep the knee tracking second and third toe, pelvis level with the floor. On the way down, really slowly down, pelvis level. Just reset every time. Don't start in a bad position, so we're going to, every time lower down, get the pelvis level with the floor, and then before you lower yourself down, make sure you set. Just do one more. Down. Go down into tripod, lift the back knee, take that foot backwards, down into quadruped, then into low quadruped. Okay, so we want to make sure we've got neutral, so we're going to tilt the pelvis backwards and forwards until we feel like we're in the neutral spine. Shoulders active. Try and pull that upper back into extension, so down towards the floor without going into lumbar extension. If you feel like you've done that, try and keep the upper back where it is and then just tilt the pelvis backwards slightly. Okay, so once you've got yourself in the right position, we're going to work on the hip hinge again, obviously. So we're hinging, flexing the hip. So really try and close that gap between the hips and the thighs, so that we keep that neutral spine, neutral pelvis. What we don't want to do is, as we come back, round into flexion, and then as we come forwards, go into lumbar extension. So we're trying to keep neutral. So we're flexing the hip backwards. Trying not to let any movement happen through the pelvis and lower back. And then as we go forwards, keeping neutral as well. So no extension through the lower back. Backwards and forwards. So mastering this is really important, that every time you go to sit down or stand up from a chair, every time you squat, every time you bend to pick something up, being able to do a hip hinge and not flex and extend through the lower back is really important, so you don't end up overloading your lower back when you should be using your hips. Okay, so we're just going to keep the forearms down on the floor, keep the neutral spine, neutral pelvis, and we're just going to flex, extend the hip, oh my gosh, extend the knees, and then lower. So we're trying to keep that angle of the hip the same at the moment, and we're trying to keep the lower back and pelvis neutral. So as we go up, we don't just want to round through there, so we're keeping nice and low and down. So going up and down. One more. Then you're going to push up into your quadruped. Again, find your neutral. Make sure your upper back's nice and low towards the floor, shoulders active. And again, we're going to hinge, closing that gap between the hip or pelvis and the thigh, keeping neutral spine, keeping neutral pelvis, and then we're going to extend the hip. So we're coming out of that flex position. Don't lose it into the lower back. So really control it. Really think about what your lower back is doing. Become really aware of those little micro movements that are happening. So going backwards and forwards in your own time at the minute. Trying to keep that neutral spine, neutral pelvis. I find a really useful way of doing this is to actually record myself doing it, and I can keep looking over and seeing what my back's doing. So if you've got some way of doing that, that's perfect. And then just get a towel. So we're going to find neutral, curl the back feet under. Make sure you've got your breath and your brace, and we're going to lift the bum in the air, knees. So and then go down. As you lift, what you don't want to happen is to just lose it into lumbar extension. So we want to make sure we've got that core switched on, and we're lifting and lowering. Lifting, lowering, lifting, lowering, lifting, lowering. One more. Give your arms a bit of a shake, legs a little bit of a shake. Okay. Come forwards a little bit, so we're going to go into bear in a second and then into a squat. So find your neutral, upper back nice and flat, curl the back feet into your bear. Make sure you've got your neutral spine, and we're just going to hinge backwards. If it helps, take your bum a bit higher in the air. So if you come back too low, you're going to end up going into that flexion. So I always go a little bit higher and then down. And then back and down. Back. Flexing the hip and then extending the hip. Lower down. Shake off. Find your neutral again. Upper back nice and flat. Curl the back foot under, feet under. Lift the bum and knees. Hinge the hips backwards, bum in the air. Walk the hands backwards into your squat. Just going to hold that position. Breathe into your abdomen. And then we're going to slowly come up. Make sure that when you come up, you don't just lose it into lumbar extension. So slowly coming up, extending the hip. Okay. So before we go down again, you're going to find your neutral, and then we're going to go down. Put one hand on your chest, on your tummy, one hand on your back, to see what's happening. So see if you're going to that you're in that lumbar extension or too much flexion. So find your neutral. If you're in too much extension, you'll feel your lower back muscles really tightly, so they should be relaxed. Well, not relaxed, they'll be working, but they shouldn't be like two sausages either side of the back, the spine. So neutral, down, as far as you can go, back up, keeping that neutral spine, find neutral again, down, feel what the spine's doing, feel what the pelvis is doing. Mine started to tilt a little bit forward then, so I corrected it, and up, and neutral, down, do one more of these, and neutral, down, that was better, I didn't do a tilt then, and then back up. Okay, grab hold of your stick, or you can do the TheraBand, so if you put it around your feet and then around your head. So we're going to do some good mornings. I'm just going to use a broomstick. So behind the neck, we're going to find neutral. Make sure you've got your neutral spine, neutral pelvis. And we're going to flex the hip, push the bum backwards, keep the shins vertical, and then come back up. Flex the hip, keep that pelvis neutral, lower back neutral, and up. And down, push the bum backwards, up, back, down, up. Very nearly done now. Bring the broom in front of you, hands sort of just outside the shoulders. Find your neutral spine again, and then we're just gonna hinge, so pushing the bum back. Try and keep the upper back nice and flat. Shins vertical, so we're doing a deadlift, or a deadlift movement. And then, so try not to just let the lumbar spine round and the thoracic spine round, so we're trying to keep flat through the thoracic spine. And down. Keep the shoulders active as well, try not to let the shoulders round. Really trying to ingrain this hip hinge. Last one. And then the last thing to do, my least favourite, because I'm rubbish at balancing, is some single leg hip flexion. So with this, we want to try and keep the pelvis level with the floor. So get your balance, and we're just going to lift one hip. Trying not to let the pelvis sort of tuck under or twist to the side or anything. So we're just trying to keep the pelvis level with the floor, and then down. So we're flexing from the hip. Get yourself sturdy. flexing from the hip. So I'm just putting my hand on my tummy and on my back to feel that there's no movement coming from my spine and my pelvis. It's all coming from the hip. But if you need your arms out for balance, that's fine. Just nice and slowly. Try and bring your hip, knee and ankle to 90 degrees. So hip to 90, knee to 90, foot to ankle to 90, and down. Just do a couple more each side. Last one. Okay, so hip hinge is all done.